Hello, my name is Mwanguzi Shadrach. I'm a 29-year-old Ugandan doctor. I've been practicing for about 2.5 years now, and I'm very passionate about health education. I know in our settings here, people die from illnesses that can simply be prevented by knowing the right things they can do. And I've had this passion since my days of medical school. I went to Busitema University, based in eastern Uganda, and one day as a junior clerk on the ward, I interacted with a mother who had a 7-year-old boy who was a sickler, and this boy was quite affected by the illness, was not going to school, had a distended abdomen, yellow eyes, and all the typical features of people living with sickle cell disease. And I was inquisitive. I asked the mother if she knew anything about this illness and what was challenging the boy. She told me this boy ate a lot of dust when he was still young, and that's why he ended up having such complications. So I realized this mother was very ignorant even after taking care of the boy for 7 years, and that sparked my interest in spreading the awareness, teaching people about some of these illnesses and bridging the knowledge gap. Of course, I knew I couldn't do this alone. I talked to some of my friends back then in medical school, and we started an initiative that was then institutional based or university based. But then when a time came and we had to leave school, I thought I needed to do something that was now not just limited to the institution, but rather handling issues across the country. So we established a foundation called Healtorch Foundation Limited, and through this we've been able to reach out to thousands and thousands of people. We've conducted community health education programs. We've reached out to the vulnerable communities and told them about some of the common illnesses like high blood pressure, diabetes. In the year 2023, we had health calendar, and in each month we're talking about something different, and we saw very many people learning so many things. We are currently running online social media activities. We have over 17 WhatsApp groups reaching out to almost 10,000 people, and these we teach on a daily basis different things. And we also opened up for online consultation. People that are not able to reach out to health workers physically, maybe it's late in the night or they are a bit constrained financially, they are able to reach out to us, and we offer this free online consultation. And people are learning a lot. We invite specialists on our platforms and have this information shared to the different communities, and people have really learned a lot. Over time, we realized that beyond health education, we needed to also help those that were already having illnesses, but also have a source of income to kind of finance our activities. So we thought of establishing a medical facility, and we started this at the beginning of the year 2024, Healtorch Medical Center, that is based in Mengo, Kampala, and it is reaching out to the communities of Kampala. But when we get people through our online platforms that have issues, we also direct them and attend to them. One of our strategies is being a community-centric health facility that not only looks at these people as sources of income, but also as people that are very, very important to the community. And we are also looking at them as people that are vulnerable and may not have all the monies to cater for their health needs. So we offer subsidized prices to our people to ensure that they actually get better without constraining them a lot. And it has been helping us. Actually, our desire would be to offer these services at a completely free arrangement, only that we still need these finances to kind of finance our other activities. During the year 2023, when we were doing a health campaign, when we were following our health calendar, we faced a challenge to do massive engagements. Sometimes we needed to go through the mainstream media, but then you cannot do that fully when you've not paid for the airtime. So we thought we needed to have a reliable source of income that can help us reach out to most of the people. So even as we treat these people, even as we solicit for some little money, we are able to collect that money and then use it to engage in other community-related health activities and projects. And it has been good so far. We have seen ourselves growing, and I've found a lot of interest in interacting with young people, because like I said, I'm currently 29, recently made it, but then I'm the oldest in the group. The rest of the people are between the ages of 28 and 20 years. So very energetic, very passionate. Some of them are doctors, others are nurses, others are into other activities like IT, and we have seen ourselves grow. We are dreaming of a future where every Ugandan will be able to acquire the knowledge they need, so we can fight some of these illnesses that affect our people just because they are ignorant about them. And it is really possible. Most of the illnesses affecting our people are issues to do with knowledge. We can easily fight them off when we know the right things to do. We also want to appreciate the people that have supported us for this long, people that have stood with us, that have advised us, that have taught us, and we pray that even the rest of the people that kind of get to learn of such an initiative can join hands with us and push us to serve the community where we come from and save our generation that is definitely going to be the generation giving birth to the next generation, and the cycle continues. I love you so much. I'm Mwanguzi Shadrach, Healtorch Foundation, Healtorch Medical Center. God bless you.